Save the Bay flotilla included more than 125 working lobster boats and recreational vessels. The American Aquafarms project would raise some 66 million pounds of Atlantic salmon at 2 sites in the bay. The company reports that its salmon projects can help sustainably feed the planet. Opponents are concerned over the potential for environmental degradation and impacts to traditional fishing and natural scenery. Gas prices in Maine remain unchanged from last week, with an average pump price of $3.09 per gallon. That's according to Gas Buddy's daily survey of more than 1,200 stations across the state. Gas prices are currently 1.2 cents lower than they were a month ago, but more than 87 cents higher than a year ago. Prices are ranging from a low of $2.85 a gallon to a high of $3.39 per gallon. Nationally, gas prices are running about $3.12 per gallon. In weather, a humid, stormy day today, then dry for most of the week, and then the remnants of Tropical Storm Ida may track this way toward the end of the week. Today, mostly cloudy statewide with showers and thunderstorms developing. Some could be quite strong this afternoon. Very humid and sticky. Temperatures in the 70s north to mid-80s in the south.
Support for NPR comes from NPR stations. Other contributors include the estate of Joan B. Kroc, whose bequest serves as an enduring investment in the future of public.
Welcome to Maine Calling. I'm Jennifer Rooks. The pace of the pandemic has picked back up recently. COVID cases have risen, and now the push for booster shots has begun. Today, Dr. Nirav Shah returns to address your concerns about the latest COVID recommendations and how to interpret them. Dr. Shah is director of Maine's Center for Disease Control and Prevention, of course. And we are taking your questions and comments. Send a brief email to talk@mainepublic.org. You can tweet at Maine Calling or find us on Facebook, Instagram, or give us a call at 1-800-399-3566, 1-800-399-3566. Please note, today's program is also being live streamed. You can watch us at mainepublic.org or on Maine Calling's Facebook page. Welcome back to the program, Dr. Shah. I hope you are enjoying summer just a little bit here in Maine.
Well, good morning, Jennifer, and good morning, everyone listening in Maine.
Let's start with an overview. Talk about the trends you're seeing this week and over the weekend in Maine. What are those trends and what do they mean to you?
There are 3 trends that I want to zero in on. The first is not a COVID trend, but as much a psychological trend as it is an infectious disease one. I feel like just over the last couple of days, and certainly over the last couple of weeks, the level of anxiety that we all have with respect to COVID has gone from whatever it was at baseline to ratcheting it up threefold, tenfold. I see it with my team here at the Maine CDC. I see it with our friends. I see it with people that I meet when I'm out and about. Let me start today by acknowledging that this is not the summer that any of us thought we were going to have. Indeed, it seems like just a couple of weeks ago, over the 4th of July weekend, we were effectively thinking of COVID as something that was going to be in the rearview mirror. But now here we are with it squarely in front of us. And I just want to acknowledge that anxiety and talk about where it comes from. The fact that we have more cases, the fact that hospitalizations are up, and the fact that I recognize that for many of you, it seems like public health guidance is changing every day, every week, and you're feeling whipsawed by that. I get where that comes from, and I get that for most of us, we kind of are asking ourselves, geez, would it be possible just to unplug and plug back in the summer in Maine and see if that gets it reset and back on track? It's hard to do, but things are going to eventually get where we want them to go. Right now, we're in a bit of turbulence. Let me talk about the other 2 things that we're seeing right now. Some of them are concerning, but some of them are good. On the concerning front, cases are going up, positivity rates are going up, and hospitalizations are going up. Those 3 things in total are concerning. As of this morning, for example, 69 people were in an ICU bed in Maine. But at the same time, there's the third thing, which is there are good signs on the horizon. Vaccination rates are up over 50% just in the past 2 weeks. And thankfully, those who have been vaccinated are not experiencing high rates of disease. So right now, there's this cognitive dissonance between bad news being coupled with good news. And I'm looking forward to chatting with everyone to help sort it all out today.
When we had Dr. Dora Mills and Dr. Jim Jarvis on the show earlier this month, they were concerned about the rate of especially new hospitalizations, seeing new hospitalizations shooting up and referring to this as almost the new pandemic. What is your assessment of where we are in terms of hospitalizations in Maine now, 2 weeks later?
I share the concern that Dr. Mills and Dr. Jarvis, as well as their counterparts from other Maine hospitals, have expressed. Let me go through the numbers first, Jennifer. The set of numbers is as follows. As of this morning, there are 136 people in Maine hospitals with COVID-19. 69 of those folks are in an intensive care unit, and 28 of them are on a ventilator. At the same time, we have about 329 total ICU beds, and of those, and what we have available are 69. The number of beds that we've got available has come up in recent days after my colleagues here at Maine CDC have been huddling with hospital employees, hospital staff to see what we can do to increase that capacity. I want to take a moment to thank the hospital systems in Maine for helping us get that capacity up, but it's still concerning. The other concerning fact, not aside from the capacity, is who is being hospitalized. Generally speaking, what we are seeing is that the majority of individuals who are in the hospital with COVID-19 are not fully vaccinated. Writ large, it varies from 70 to 75%, and that's a number that's been stable for several weeks. But what's even more concerning is not just who's in the hospital, but who's in the ICU. Indeed, as of last week, the entire ICU of COVID patients at Maine Medical Center, all the COVID patients in the ICU were unvaccinated individuals. So we're starting to see a bifurcation of the pandemic into those who are vaccinated, who, although they can get sick, those sicknesses occur at lower rates. And then the other fork of the pandemic, which is the unvaccinated, because of the Delta variant, their risk of getting disease, getting in the hospital, and indeed even landing in an ICU continues to go up.
Let's talk about the recent FDA approval of the Pfizer drug as no longer being the regular FDA approval, no longer as an emergency approval. How significant is this in your eyes? What is the outlook for when other vaccines may follow?
I think this is a good and significant step for the US FDA to take. Let's recognize that they do these things if and when they have the requisite amount of data that supports it. It's not as if the acting FDA commissioner got up one morning and said, I think today's the day. They do these things if and when all of the data are there and are in support. And they reached that milestone a week or a week and a half ago, and were able to move from the emergency authorization to the full approval. This is significant for a few reasons. There are some folks who have been on the fence and who have indicated, at least to surveyors and pollsters, that the emergency status of the Pfizer vaccine was not good enough for them, and that they wanted the literal seal of approval from the FDA. Now they've got it. So I'm hoping to see some of those folks come off the fence. How many remains to be seen. The other thing that the full approval means is that organizations, institutions may start moving toward mandating the vaccine with a little bit more security on board. The third thing is that for those folks who said, I don't want to get that vaccine until it's fully approved, for some of them, that's going to be the case, and they're now going to get the vaccine. But for others, that notion may have been a pretext. With the full approval, we now have an opportunity to dive deep and figure out if it wasn't the approval that was holding people back, what was it? And this gives us an opportunity to really get to what might be the heart of the issue around hesitancy.
Let me ask you this. If we know that the governor has mandated that all healthcare professionals be vaccinated by October. We also know that there's been pushback by many groups within that, including EMS workers and some other groups. How is it going? Have we actually seen healthcare workers announce their resignations? Or have we seen a surge of people within Maine's healthcare system come and get vaccines since that announcement was made?
We've seen a bit of both, but I'd say what I've seen more of is the latter, which is folks going and getting vaccinated. Jennifer, my thought on this to start with is that I wonder when I think about this issue, how much of what we see is a vocal minority versus a silent and supportive majority. My hunch from chatting with healthcare workers across the state is that many healthcare workers are part of that silent and supportive majority. But often what we see in any situation are those who are concerned about it. Our numbers suggest that healthcare workers are getting vaccinated. Anecdotally, in chatting with colleagues at healthcare systems across the state, they too have seen their employee clinics be more subscribed. And again, our numbers bear that out. But I've also gotten concerns, I've gotten emails and calls from other healthcare workers who have expressed their concerns about the possibility that their staff may resign or not come back following October 1st. That's a concern and that's a risk. It's one that I take seriously. But Jennifer, in my view, it has to be balanced against the fact that what's causing healthcare shortages right now is COVID-19. So I know that there's a longer term concern about this requirement causing healthcare worker shortages, and that's a debate and a discussion we are having and should have. But we should go into that recognizing that right now, today, COVID-19 is causing healthcare worker shortages because healthcare workers get exposed on the job, meaning they have to be out in quarantine. So right now at baseline, we're seeing shortages. The question is, net of net, will this requirement make our healthcare workforce safer? And my view is that it will.
We know that some people already qualify for a booster shot. What can you tell us about how many booster shots have already been given? A third shot have been given in Maine. Who qualifies today? Who do you expect to qualify soon? Give us a sense of how that's going and how you expect it to go in the future.
I'm optimistic about how the rollout of third doses will go. Let's start with today, right now. Who is eligible for that third dose? Right now, according to the US CDC and the US FDA, the folks who should be getting that third dose of Pfizer or Moderna vaccine are individuals who are severely or moderately immune compromised. Now, what does that mean? Well, to qualify as being moderately or severely immune compromised, that means you are someone who is, for example, actively undergoing treatment for cancer, or someone who's received an organ transplant, or someone with an HIV infection. These are folks whose immune systems are not able to take the vaccine and mount an immune response after that. But with that third dose on board, their chances become that much better. So if you fall into one of those categories, today is a good day for you to go get your third dose, and don't delay. They've been happening all across the state of Maine. But at the same time, there are other folks who are not severely immune compromised. What about them? Right now, the current plan from the federal government, US CDC and US FDA, is to begin the rollout of booster shots during the week of September 20th. So coming up here in about 3 weeks. And this will apply to folks 8 months, as is the current plan, although that could change, 8 months to the day after they've gotten their second dose of Pfizer and Moderna. I'll talk about J&J in a second. Let me say a couple of things, though. There's been a lot of concern and question about when to get your booster, where to get your booster, how to get your booster. Those are good questions. We are focused on making sure you can get your booster at the right time. I just want to note, Jennifer, we're also still really focused, not on third shots, but on first shots. We've got to get folks who haven't had a single shot their vaccine, and that's a lot of our energy right now. The other thing is that although the federal government has recommended 8 months, it does not have to be 8 months to the day, hour, and minute that you got your second dose. it should be at least 8 months. But if it's 8 months and a couple of days, that's okay. The third thing is that for a lot of Mainers, that's going to come around the time that you should also be looking to get your flu shot. So we're trying to figure out how to weave in your booster of COVID vaccine along with your flu shot. I can pause there, Jennifer, and if you want me to, I can go into the J&J piece because that's come up a lot, but I'll turn it back to you first.
Sure. I think J&J piece and also flu shot piece. Is it a good idea to try to not have either a booster shot, or if your timing is for your second vaccination shot at the same time as your flu shot?
No, I'm glad you asked that. You can get both shots, your booster and your flu shot, on the exact same day at the exact same time. There is no contraindication or concern around getting them both simultaneously. And indeed, for convenience, for ease, that is a really good strategy. It's one that we're going to try to roll out. We also recognize that these vaccination spots can be really busy. So we want to balance getting folks the shots they need with getting them in and out the door really quickly. But another question we've gotten is, what about folks who have gotten J&J, whether you're immune compromised or not? And the data there are still coming out. Just a couple of days ago, Johnson & Johnson published some data on the effectiveness of a second dose of their shot for folks who got the first one. And the data are encouraging, but those data came out in a press release. And frankly, I don't like to do policy by some numbers that were published by the company in a press release. We're all waiting to see the actual data so that FDA and CDC can vet it and kick the tires and make sure it holds up.
Dr. Shah, I know someone who is in that small group of people who did qualify to receive a booster shot, and she did have quite a reaction to that shot and really felt rotten in the 24 hours after she received it. Is that to be expected, and why did she feel that way?
Much like getting your second shot, which I think for a lot of folks, the second shot put them out of commission for 8, 12, even 24 hours. What's going on there is that the body's immune system is recognizing that second or soon to be third dose and recognizing that as something it needs to activate. That is literally how vaccines work. They teach your body's immune system to be ready to fight something if it encounters it again. And whether it's your third dose or your second dose, this is your body's immune system not just being primed to fight, but actually waging the fight, bringing the fight to the virus and to the particles itself. Unfortunately, one of the side effects of your body's immune system revving up is feeling really crummy. And so what we're seeing a lot of is with second doses and probably with third doses, although we don't know yet, but probably also with third doses, you might want to plan for not going to a big party after your third dose because you might prefer to be in bed for a bit.
Yeah, so probably a good idea to just be aware of that. We are, of course, speaking with Maine CDC Director, Dr. Nirav Shah. You won't be surprised to hear Dr. Shah lots of click, but we do need to take a quick break. If you have a question for Dr. Shah, you know the number, 1-800-399-3566. If you want to send an email or post on Facebook, please keep your question brief. We will be right back with Dr. Shah and your questions after a break.
Listener support brings us Maine Calling with help from Fallbrook Woods, a Maine-owned assisted living community in Portland, supporting the unique needs and individual styles of those with memory impairment. fallbrookwoods.com.
I am Abdi Efton, a member of the Maine Public News Connect team. Each week, Maine Public News stories are translated into Spanish, French, Portuguese, and Somali to provide important news to Maine's diverse communities. Maine Public waxay samaysay adeeg cusub oo ah warar oo aan filayno inaad ka heli doonto. Isbuuc walba waxaan af Soomaali ku samaynaa muuqaallo kooban oo ah wararka isbuuclaha ah ee gobolka Maine. Wararkaas oo bulshadeena gaarsiinaya akhbaaraad muhiim u ah. Maine Public News Connect ayagoo muuqaallo ah ayaad ka helaysaa khadka mainepublic.org galab walba oo Jimco ah. Sidoo kale waxaad ka helaysaa Facebook iyo YouTube. Please help us spread the word about this exciting new service. Thank you.
And welcome back. This is Maine Calling. I'm Jennifer Rooks. Joining me today, Maine CDC Director, Dr. Nirav Shah. We are getting answers and advice regarding the Delta variant, changes in safety recommendations, vaccines, and boosters. You can share your questions via email, talk@mainepublic.org. You can find us on Twitter, Facebook, or Instagram, or give us a call at 1-800-399-3566. And you can view today's conversation with Dr. Shah. The live stream is available at mainepublic.org or on Maine Calling's Facebook page. I'm going to start here with an email from Ryan. I read that Maine is one of the few states that are actually tracking COVID breakthrough cases, that is, vaccinated people who still catch COVID. I was wondering how these cases are being tracked. I was unfortunately one of them, but was never contacted by the state other than a text message about isolation and contact tracing after testing positive. Are breakthrough cases simply being tracked by comparing databases for those who test positive and databases for those who are already vaccinated?
Well, it's a great question. We are keeping tabs on breakthrough cases, so we have a good sense of how those are evolving and emerging. Let me start with the numbers first. As of Friday, we've received 1,818 reports that we've confirmed of vaccine breakthrough cases in the state. Now, some context is important there because the other number to keep in mind is how many other people got COVID that were non-breakthrough cases since January, when folks had an opportunity to get vaccinated. And that number is almost 40,000. So although breakthrough cases are occurring, they're occurring at a rate that is mathematically predictable. And as more people get vaccinated, we're going to have more breakthrough cases. We track breakthrough cases by an algorithm that looks for individuals who have tested positive and then determines whether that individual has had evidence of vaccination. And then when we find one, we do a manual check to make sure that everything is accurate. This allows us, as you noted, to make sure we're keeping tabs on this. This is important for epidemiological reasons. But, and I just want to emphasize, this is not actually how scientists at the CDC determine whether, for example, the effectiveness of a vaccine is waning. That's done by a different set of calculations. Breakthrough cases are important in guiding that analysis, but the fundamental type of analysis that we do or they do to help us understand how the vaccines are doing takes a much broader look and compares rates of breakthrough cases among people who haven't had the disease at all. That's a different calculation that's equally important.
All right, we'll go to Susan, who's calling from Gray. Hi, Susan, go ahead.
Yes, good morning. Thank you for taking my call. I have rheumatoid arthritis, and I recently got the third shot as recommended by the CDC. I'm wondering if I should also be thinking about getting a booster shot as well.
In the future?
Yes.
Well, if you've gotten your third dose, presumably because you fall into that 2 to 3% of the population that is severely immune compromised, then as of right now, the recommendation is that you can hold tight. There may be a recommendation in the future for folks who are immune compromised to get a fourth dose or perhaps even other doses. But for right now, if you're immune compromised and you've gotten that third shot, and I commend you for going out and getting that third shot, you're in good stead based on the latest science we have today.
All right, Susan, thanks for your call and good luck to you. We have here a tweet from Nick. For people who have had reactions to vaccines in the past, have there been tests or data on those people taking the COVID-19 vaccine?
There have. I've discussed the data with some health providers in Maine just as recently as late last week. What we've seen is that even folks who have had reactions to other vaccines have been able to successfully get any of the COVID shots under the supervision or direct eye of a healthcare provider. Indeed, even during the era when we had the large-scale vaccination clinics set up to manage 1,000, 2,000, 3,000 people per day, those sites, more often than not, had a special wing where folks who had previously had some type of reaction could still get their COVID shot under close and constant supervision And by and large, those individuals did quite well with the COVID shots. So the bottom line there, Nick, is having had a previous reaction to another vaccine is not necessarily a reason to forego getting the COVID shot. It is a reason to go get the shot, but tell the provider right up front that you've had some prior reactions so they can keep a close eye on you.
When you say by and large, so clearly the answer is not none, but is a small number, a minuscule number? How would you characterize it?
I would even characterize it as an infinitesimal number. But of course, in medicine, there are never absolutes. Indeed, one of my rules is never, ever speak in absolutes. And so in these situations, we can't categorically rule out the possibility, but we have to ask ourselves the bigger question, which is what's the bigger risk out there? Is the bigger risk a possibility of having a reaction or the high likelihood of getting infected with the Delta variant? And what we've seen overall is that even folks who had prior reactions have been able to get the COVID vaccine, generally speaking, without any concerns.
All right, we'll go to Ari calling from Brunswick. Hi, Ari, go ahead.
Hi, I was calling in regards to just asking about why we weren't doing a similar protocol as California and having our medical professionals and support doing Binax testing and wearing extra PPE so that we don't hit that crisis level of staffing, because how are we supposed to support the individuals in the state of Maine levels that we could potentially lose?
Well, I'm pleased to report that we are. Depending on the level of exposure that a healthcare worker may be facing on a day-to-day basis, we've recommended and they've been offered N95 masks along with the fit testing that makes those masks as effective as they can be. In terms of Binax Now testing, where it's necessary, for example, when there's been an exposure or something of that sort, Binax Now testing has been liberally used across healthcare facilities, clinics, hospitals, nursing homes across the state. I think the combination of those two things has meant that we have been able to keep a lid on the number of cases of COVID-19 that we've seen. That being said, we've still had 1,900 cases of COVID-19 among healthcare providers since January, since when the vaccines were available. That's one reason I feel strongly about making COVID-19 vaccines a condition of employment so we can keep those healthcare workers as safe as possible.
Thanks for your call, Ari. An email here from Dawn. Get the COVID-19 vaccine. Her doctor recommends that she get the Pfizer vaccine. I am trying to reassure her. Can you tell me how many people have died from getting the Pfizer vaccine?
Worldwide, those data are available on the CDC's website. There have been a handful of individuals who have had a rare condition, a rare heart condition. A small subset of those individuals have passed away worldwide. Again, those numbers are available on the CDC and the FDA's website. And we're talking worldwide, around on the order of hundreds of millions of doses of the Pfizer vaccine that have been administered around the world. And the number of individuals who have passed away as a result of that is vanishingly low. That has to be compared against the risk of getting COVID right here, right now in the state of Maine. Let me provide you the numbers on that. The rate of infection in the population here in Maine, the risk of getting COVID, if you're unvaccinated, is 8 times higher than the risk of getting COVID if you're vaccinated. And your risk of landing in the hospital in Maine, if you are unvaccinated, is over 7 times higher than if you are vaccinated. So right now, here in Maine, your chances of getting COVID and landing in the hospital are 8 and 7 times higher. To me, getting vaccinated right now in the era of the Delta variant, honestly, it's not even a question.
An email here from Karen, and this represents a lot of other questions that are coming in, Dr. Shah. My daughter's school district voted to make masking optional, although recommended. While the district is participating in pooled testing, has updated ventilation systems, and is still spacing at lunch, this decision has caused us to reconsider sending her to school this year, at least until she is vaccinated or they change their masking policy. Is our concern scientifically accurate, or are we misunderstanding the power of other preventative measures the district has in place? We have viewed masking as the next best tool to vaccination, although we can't wait for her to get vaccinated. Finally, masks are not required on the playground, and I don't think the Maine CDC has changed its guidance on this issue. Is playing unmasked outside still thought to be a relatively low risk, even with Delta?
Those are excellent and eminently reasonable questions, and I'm glad that we're able to talk about those today. Let's first start with how we should think about kids being in school not wearing masks. And you're right, the recommendation from the US CDC and Maine CDC continues to be that schools, school districts should require all individuals in a school building to wear masks, irrespective of their vaccination status. Some districts in Maine have done so, some have not. For those who have not, as the email notes, districts have put into place other mitigation measures. And it's not that one mitigation measure trumps them all, maybe except for vaccines. They all work in concert with one another, in harmony with one another. And ventilation and spacing are helpful, but a mask would certainly be that belt and suspenders that all of us are looking to take right now in the midst of the pandemic. Now, whether and what that means for your child's attendance in the classroom, that's a highly individualized decision. It depends on who you have in the family. It depends on the health of your child. So it's not one where there is a one size fits all answer. But adding a mask on top of that for your own child certainly helps protect them. It will also protect other students in the classroom if your child happens to have COVID. So irrespective of what the school is doing and requiring, even though I wish they would require it, having your own child wear a mask is something that protects them and will protect others. And if enough people do that in the classroom, that starts getting us toward the protection we're looking for. In terms of outdoor activities, thankfully, the data continue to support the relative safety of playing outdoors, even in the midst of the Delta variant, even if those individuals, in this case, the school children, are unmasked.
We'll go to Ellery calling from Waterville. Hi, Ellery, go ahead.
Hello, and thank you for taking my call. I was wondering, with the transmissivity and communicability of the Delta and Lambda variants, I haven't heard much mention made of changes in the PPE. I was wondering if perhaps better masks are warranted, better face shields or goggles, or perhaps increasing social distance. If the science isn't there yet on these two variants to make those kinds of changes as yet in the PPE.
What a great set of questions, Ellery. Let me first just put a footnote in your question with respect to the Lambda variant. Thankfully, we have not detected the Lambda variant, so far as I'm aware, in New England, certainly not in Northern New England, and definitely not in Maine. Let us hope that stays that way. Sadly, history suggests that it will not. But your other questions are quite perceptive, and that has been discussed by public health scientists about whether, in light of the greater contagiousness, we need to make other amendments. And thus far, the thinking has been that the existing protocols for things like PPE usage, as well as distancing, continue to hold. And here's why. The Delta variant, even though it is more contagious, still relies on hitchhiking on a water droplet or aerosol droplet, the droplets that we normally emit when we talk or laugh or sing or cough. And so without that ride that the virus gets on one of those droplets, the virus doesn't survive very long on its own. And those droplets, those rides that the virus hitchhikes upon, still need to penetrate the defenses of the mask. So the masks still remain effective at their current levels, even in the midst of the Delta variant. But that could change And I know that there's research underway to better characterize that.
Ellery, thanks for your question. An email here from Kay. Our small nonprofit is scheduled to host a large indoor event in October of between 350 and 400 people at a hotel conference facility. We've been trying to focus on risk reduction, requiring vaccination or testing, requiring masks, trying to plan for distancing across the event. In early August, I reached out to a variety of public and private health entities for help with risk mitigation, including the Maine CDC. Is the Maine CDC considering event capacity restrictions to level the playing field among event providers so people don't just crowd into whatever event they can find? If so, will there be new financial help for affected event hosting organizations? Alternatively, is there any sort of response effort among public or private health or convention entities to help large event hosts and venues reduce attendee risk as much as possible? And this person notes that so many nonprofits depend on events to keep going.
And there's no question about that. I mean, this is one of the side effects of the pandemic that a year and a half ago would have been hard to foresee, but are now facing us, because indeed events of this nature, fundraisers, are critical to help organizations continue to provide other things that we've suggested, that the US CDC has suggested, remain in place. We don't have any current plans to amend those by adding on things like capacity restrictions at this time. And those guidelines go back to the world that we were in sort of starting last summer, which is to think about things like the density, the number of people, the duration of the event, the degree of ventilation, with one new variable added to the calculus right now, which is vaccination status. If a group of people are fully vaccinated in a venue that is not terribly congested, with ample ventilation, with masks on top of that, the risk level goes down significantly. Each of those that you remove from the calculus, be it masks, ventilation, density, the risk level goes up commensurately. There is no one-size-fits-all approach to safety, because the other variable are the attendees and what their risks are and how many of them may be at higher rates of disease, and then who they live with. There are so many variables right now that it's impossible to say with certitude what constitutes safe and unsafe, but we rely upon the good work of planners themselves to make those judgments for their groups. We are able to assist as needed.
Well, we do need to take another quick break. We're speaking with Maine CDC Director Nirav Shah. We'll be right back.
Listener support brings us Maine Calling with help from Cape Integrative Health, committed to working with Medicare patients to treat chronic lower back pain with acupuncture. Learn more at capeintegrativehealth.com. And A Family for Me, a Spurwing program committed to raising awareness of the need for foster and adoptive parents. Learn more at afamilyformemaine.org.
I'm Scott Tong. Reporter Craig Whitlock of the Washington Post has uncovered a trove of government documents and audio files telling an inside story of the Afghanistan war.
It was remarkable the degree to which they were struggling to figure out who the enemy was. The shorthand for them was the bad guys.
That's next time on Here and Now.
Here Now is coming up shortly after Maine Calling from 12 noon until 2 on Maine Public Radio. Many businesses and organizations in and around Maine join listeners in supporting various programs on Maine Public Radio and Maine Public Classical. You hear their mentions every day. To learn how your business can benefit from supporting Maine Public Radio and Classical, Maine Public Television, or mainepublic.org, please visit our website, mainepublic.org. Click on Support and connect your business with our audience. Or you can call us at 1-800-884-1717 and ask for Dionysia Gaddis. And of course, thank you for your support of public broadcasting here in Maine.
Welcome back. I'm Jennifer Rooks. You are listening to Maine Calling, and back on the program today, Dr. Nirav Shah, taking your questions about COVID-19 and public health precautions. If you'd like to watch the live video of today's show, you can find the live stream at mainepublic.org or on Maine Calling's Facebook page. So many questions coming in. We're going to go to Joanne calling from Harrison. Hi, Joanne. Go ahead.
Hi, Jennifer. Hi, Dr. Shah. Thank you so much for this program. I'm concerned about getting the second J&J booster since I had an anaphylactic reaction to the vaccine in April. Also, my concern about getting both vaccines together, the flu and the booster. If you develop an allergic reaction, how do you determine what drug or what vaccine caused it? I'm thinking just getting the flu shot and waiting and seeing what J&J says about their data for a booster.
Totally understood, Joanne. Thus far, we have not seen significant or even notable concerns with individuals who have gotten both shots, flu shot and a COVID shot at one time. There's always concerns about giving any medication along with another one at the same time for the reason that you note. But in our day-to-day lives, I think many of us are used to taking 2 pills at the same time. We always run that risk. And in this situation, we haven't seen significant concerns that have arisen from co-administration of the COVID shot with any other vaccine, be it the flu vaccine or childhood vaccines as well. Now, in terms of the J&J vaccine, there are still data that are coming out. Again, the company just released some by a press release last week. Those data need to be fully vetted by the CDC and the FDA. But the early read on those data were positive. What that ultimately means for when boosters or second doses of J&J will become necessary or advisable, that's an open question. But I was encouraged by those data. And when they've been vetted by the CDC and FDA, if they continue to be favorable, I'll look forward to recommending those boosters of J&J as well.
Joanne, thanks for your question. I have a question here, an email from Mary. Are the results of home tests reported to the Maine CDC? If not, is it likely that Maine has a higher number of cases than official data show?
Generally speaking, home tests are not reported. We welcome folks to report their results to us, but the only folks who are required to report COVID-19 results are healthcare providers. That is the fact that there are more cases of COVID-19 than our official numbers show is a given. It's a given in any outbreak or epidemic, no matter what. Something that we've talked about here in Maine for about 18 months now, 17 months. That is always the case, that in any outbreak situation, we're only seeing a certain percentage of the iceberg based on mathematical approaches, which is what we do and how we think about these things. But home tests, the question for home tests is whether the benefit and convenience outweighs the fact that state health departments do not receive those data. Early on, there was resistance to home tests for exactly the reasons you mentioned. But now we feel like the convenience of having a home test outweighs the drawback of not having those tests reported to the state health department.
We'll go to Brian calling from New Gloucester. Hi, Brian. Go ahead.
Hey, how are you?
Good.
A couple of quick questions I've got. Can you hear me?
Yeah.
All right. A couple of quick questions. And this actually plays to the lady who had a reaction to the vaccine. I've heard varying things about getting, like mixing and matching. Is that recommended for the booster or frowned upon? And my second question would be to Dr. Shah, if the state is possibly considering putting in another mask mandate, because as a small business owner, it really makes it kind of tough to be the mask police.
Yep. Let's take both of those. Let's start with the mix and match. Right now, there are some early data on the mix and match approach. You got one Moderna, and then when you got your second Moderna, then maybe your third one is Pfizer. The data are from relatively small studies. They were encouraging, but generally speaking, when we're talking about something like policy on boosters for the entire country, we don't want to base it on a small study. We want to really have fully vetted, accurate information. So those studies and that analysis is underway. Hard to say where that will land. With one interesting exception. For the folks that I mentioned earlier who are immune compromised, who are already getting in line for their third dose, the recommendation from the CDC is you should try to get your third dose of the same vaccine that you got your first two. But if you can't, according to the US CDC, it's an RNA vaccine. So I think we're starting to see some emerging data on the mix and match. but too early to tell what it means for those who aren't immune compromised. On the mask mandate, our approach since the end of the state of civil emergency has really been to focus on recommendations rather than requirements. This is for a number of reasons, but we recognize that leaves you in a tough spot. That being said, even if we were to put a mandate back into place, ultimately it would still be small business owners who would have to be the ones policing it, saying, hey, the state says you need to do this. Right now, what you're willing and able to say is, I recommend and require you to do this if you want to come on my property. And that's something within your purview. I say that recognizing that it's not easy for you to do, but it is something that's within your purview.
All right, Brian, thanks so much for your call. I've got an interesting question here, an email from Loretta. Are there any breakdowns for the breakthrough cases as to whether they are Pfizer, Moderna, or J&J?
Yeah, we haven't seen, so when you do that analysis, you've got to be really careful because you have to control for the amount of time that the vaccines have been on the market and the number of people who have received each of them. So if we were just to do that analysis and be sloppy, you would think administered until early April, whereas the others were mid-December. We've looked at that and we have not seen that one vaccine accounts for a higher proportion of breakthrough cases than the other, which is exactly what the math would predict.
An email here from Sandy. Could you address the subject of using ivermectin as a preventative treatment for COVID-19? My husband was at our local farmer supply store trying to purchase ivermectin for my livestock, and the lady helping him told him it could be used for this purpose, and my husband was horrified. Now I am seeing this come up in the national news.
I'm really glad that you raised this. This is a really important topic. Ivermectin is a drug that has and can be used in humans. It's also used in horse and sheep for other applications. Lately, there has been discussion about using it, particularly the veterinary formulation, to prevent COVID. There are some very uneven data from small studies that were not well controlled on the use of ivermectin in treating COVID. The studies that have been larger and well controlled have found that ivermectin does not help with the treatment of COVID. There are no data to suggest that it is either safe or effective to use ivermectin to prevent COVID. I want to say that again. There are no data to suggest that it is either safe or effective to use ivermectin to prevent COVID. There are data to suggest that getting a shot of COVID-19 vaccine is exquisitely effective at preventing you from getting COVID. You're listening right now and you're worried about getting COVID. The vaccine is far safer than taking a sheep pill.
An email here from Mike. Why is the current outbreak so much more pronounced in Penobscot County than elsewhere in Maine? He gives total cases in the 2 weeks leading up to August 26, Penobscot 551, York 480, Cumberland 284. Could this have something to do with waterfront concerts not requiring masks or proof of vaccination, which Thompson's Point and State Theater require? Kiss's lead singer, he writes, testified positive for COVID days after playing Bangor's waterfront concert, where hundreds of fans were jammed together in front of the stage in the pit.
It's a possibility. We've also seen these spikes, these variations of high and low, traverse the entire state throughout COVID. Just a couple of weeks ago, Waldo County was one of the highest counties in the state by a large margin, and it's fallen. Now, Penobscot's higher. It may be because of concerts, although we have nothing to suggest that. Our data have not revealed that, for example, large numbers of new cases in Penobscot County had any connection with any of those concerts or had attended one. I should note, for example, that there have been large concerts that have been held across the country. For example, Lollapalooza in Chicago, which did not generate large numbers of cases. Some of them have had vaccinations, some of them have had not. By and large, these are outdoors, which greatly reduces the risk. It does not eliminate it, however. And so if you're going to one of those concerts and you're concerned or you live with someone who's immune compromised, there is nothing wrong with wearing a mask on top of being vaccinated.
All right, we'll go to Philip calling from Auburn. Hi, Philip, go ahead.
Hi. Thanks for taking my call. I had 2 Moderna shots, the second in March. Both were administered at Gillette Stadium. I've since moved to Maine. Is there going to be any problem with me getting a third shot?
Now, many months ago, we removed the requirement that you had to be a Maine resident in order to be vaccinated in the state. That's because we've got plenty of vaccine and plenty of folks who are able to give it as of right now. So anyone who happens to be in the state of Maine and is willing to be vaccinated can be vaccinated here.
Thanks for your question, Philip. A question here that's coming in pretty commonly, an email from Sally. A friend is arriving today on a flight from California. We are both fully vaccinated with the Pfizer vaccine. Should we wear masks when we are in the car together, the house?
Well, provided that neither of you is immune compromised, neither of you lives with someone who's immune compromised, neither of you just got exposed to somebody the other day, generally speaking, 2 people who are fully vaccinated can be around each other in a car or in the house without wearing masks with a very low level of likelihood of getting or transmitting COVID.
All right. An email here from Maggie. As we enter the fall cold and flu season, I'm wondering how we should decide when we should get a COVID test. Should we assume that any case of the sniffles, cough, etc., could be COVID? My husband and I are both fully vaccinated, but we do have contact with a fair number of people during our workday, though we are masking and we see our unvaccinated grandchildren.
Yeah, this is a great question. It came up last year. So first of all, it's hard to believe that we're going into our second season of cold and flu in light of COVID in that era. There is no easy answer. Part of it comes down to knowing your body and your own symptoms. If what you feel like you've got in the morning is really truly allergies, then you should go with that. But if you are in doubt, or alternatively, if the symptoms that you've got are severe, namely a significant cough, a high fever, shortness of breath, you should absolutely get tested. If you're on the fence about it, erring on the side of safety is not a bad thing in an era of a pandemic. The way you can do that is by making sure you've got some of those rapid tests at home ready to go if you happen to develop symptoms. They are available at drugstores and department stores across the state now.
All right. Well, as always, thank you so much, Dr. Shah, for joining us and offering advice. Dr. Nirav Shah, Director of Maine Center for Disease Control and Prevention. Today's sound engineer was Sandra Harris, and we had help from Nick Woodward, Nick Godfrey, and Andrew Catalina. Maine Calling is produced by Jonathan Smith and Cindy Hahn. This show will re-air tonight at 7 o'clock. Visit mainecalling.org for more information about our programs and to sign up for our podcasts. Tomorrow on the program, the top news stories in Maine during the month. I'm Jennifer Rooks, and you have been listening to Maine Calling on Maine Public Radio.